Hi, this is Dr. Mehta. This is the last part of disaster management topic. In this video, we will discuss about institutional framework of disaster management in India. Disaster Management Act was passed on 23rd December 2005 under entry 23 in the concurrent list of Constitution of India. It permits states to have their own legislation on disaster management. This is the hierarchy which we follow in India. It is a top-down approach. Central government, central level, state, district level, and local government level. Ministry of Home Affairs is the nodal ministry. Uh, NDMA is the apex body. Then National Disaster Management Authority. It is the apex body for disaster management, headed by Prime Minister of India. It is responsible for laying down policies, plans, and guidelines for disaster management, coordinate their enforcement and implementation for timely response to disaster. At national level, we have different committees like Cabinet Committee on Management of Natural Calamities, Cabinet Committee on Security, High Level Committee, Central Government Ministries and Department, National Crisis Management Committee, National Executive Committee. National Executive Committee, Home Secretary is the chairman of NEC. They prepare the National Disaster Plan, ensure implementation of approved National Disaster Plan and policies, coordinate and monitor implementation between different agencies. National Institute of Disaster Management. They provide assistance in formulation of national level policy and disaster management, human resource development, in formulation and implementation. They develop training modules, research and documentation work, mainstream disaster management into education, network with research and training institutes at national and international level. Recently have completed the comprehensive disaster risk management framework course from 2nd August to 13 September. Anyone can pursue from NIDM website. They offer a CDRM and thematic courses. National Disaster Management Plan. Vision is to make India disaster resilient, achieve substantial disaster risk reduction, and significantly decrease loss of life, livelihood, and assets by maximizing the ability to cope with disasters at all levels of administration and among all communities. It was released by Prime Minister of India in 2016 and it got revised in 2019. This plan include early warnings, maps, satellite inputs, information dissemination, evacuation of people and animals, search and rescue of people and animals, medical care, drinking water, sanitation facilities, public health, food and essential supplies, communication, housing and temporary shelters. Then power, fuel, transportation, relief, logistics and supply chain management, disposal of animal carcasses, fodder of livestock in scarcity hit areas, rehabilitation and ensuring safety of livestock and other animals, veterinary care, data collection and management, relief employment, media relations. Then NDRF, National Disaster Response Force. We have 16 battalions of NDRF with 1,149 persons per each battalion. They are raised from BSF, CRPF, CISF, ITBP, SSB, and Assam Rifles. Uh, for each battalion, we have 18 search and rescue teams. Each search and rescue team has 45 personnel. Then one medical officer is appointed for two search and rescue teams. They are trained to respond to natural and man-made disasters and chemical, biological, radiation, and nuclear emergencies. So those are called CBRN emergencies. Then state level, we have State Disaster Management Authority chaired by Chief Minister of that particular state, State Crisis Management Committee, State Executive Committee, and State Relief Commissioner. We have district level, District Disaster Management Authority, Panchayat Raj institutions, and municipalities. District Disaster Management Authority, chairperson is District Magistrate, co-chairperson is a ZP chairman. Remaining members are CEO of District Authority, Superintendent of Police, Chief Medical Officer of the district, two district level officers designated by the state government. Then role of local government is to prepare district disaster management plan. Guidelines laid down by NDMA and SDMA are followed, and they lay their guidelines at district level. Organize and coordinate a special training and disaster management. They identify relief centers, provision of basic water supply and sanitation, early warning and dissemination of information to the public, and establish stockpiles of relief and rescue material. Other important institutional arrangements in India are armed forces, central paramilitary forces, state police forces and fire services, civil defense, state disaster response force. Then role of local actors in disaster management. Local actors are like NGOs, volunteers, religious groups. They provide relief materials, involved in rescue operations, arrange temporary shelters, organize health camp, provide training and education to the children on disaster management. A National Policy on Disaster Management 2009 to build a safe and disaster resilient India by developing a holistic, proactive, multi disaster oriented, and technology driven strategy through a culture of prevention, mitigation, preparedness, and response. Funding mechanism. National Disaster Risk Management Fund and State Disaster Risk Management Fund, as per 15th Finance Commission, allocated grant for financial year 2020 to 2021. For NDRMF, it is 12,390 crores. For SDRMF, it is about 28,983 crores. Of this, 40% is contributed to response and relief, 30% to recovery and reconstruction, 20% for mitigation, and 10% for capacity building. Role of emergency healthcare services in disaster. There are three levels of preventive health measures. Primary prevention is to prevent disease transmission to healthy population. Secondary prevention, you have to identify and treat people to reduce the progression of disease. Tertiary prevention is to reduce permanent damage from the disease, offering rehabilitative services to the patient. Then this was a medical camp at a rehabilitation center in Andhra Pradesh due to urban flooding. I was posted there. Then role of district medical authorities. Networking of medical resources and hospitals, networking of facilities and transport vehicles, medical treatment of victims, setting up a medical command structure, working in coordination with district administrative authorities. The role of hospitals in disasters. You have to ensure effective healthcare response during disaster and safety of the patient. You have to provide 24/7 emergency services, including laboratories, blood banks, ambulances, rehabilitation, aged care, and pharmacies to provide immunization services to prevent outbreak of diseases such as measles. Normally, routine immunization shouldn't be disrupted in any case of disaster, and WHO doesn't recommend any special vaccination to any healthcare workers or the general public. Then hospital emergency disaster committee. The civil surgeon of the district hospital must constitute a disaster preparedness committee with following members to prepare the hospital emergency plan and emergency manual. Members of this committee include a superintendent in charge of emergency services, in charge of surgery, in charge of orthopedics, in charge of anesthesiology, in charge of medicine, in charge of pediatrics, in charge of gynecology, or in charge from any other clinical department, in charge of nursing superintendent, then store officers, account officer, sanitation in charge, and chief medical officer. Hospital disaster management plan. The disaster is away from the hospital. You have to control large number of patients in an organized manner, enhancing capacity of admissions and treatment, ensuring proper treatment of already admitted patients to provide medication, medical consultation, infusions, dressing material, and necessary medical equipment. Then if the disaster is affecting the hospital, then the plan should be made to protect life, environment, and property inside the hospital from any further damage, putting into effect the preparedness plan measures. Appropriate actions of the staff who have to know their task in such a situation, and getting help from outside in an optimal way. Re-establishing as quickly as possible in an orderly situation in the hospital, enabling a return to normal work conditions. Uh, so we Maharana Bhopal Hospital has a color coding for disaster management within the hospital. The code red is for fire, code blue for cardiac arrest, code pink for child missing, code black for earthquake, floods, building collapse, bomb threat, terrorist attack. Then emergency contact number is 3030. In case of any of these disasters, we have to dial this number 3030 for MBGH hospital. Then we have to inform about the code and the person calling the emergency, then the location of the disaster. Then the code will get activated, which will be verified, and after control of the situation, the code will be deactivated. So thank you all. So this completes the topic disaster management.